Good afternoon. You're tuning in to the Health and Wellness Hour right here on the People Station with your favorite gerontologist, Dr. Macy Smith. The show today is sponsored by MUSC Health Orangeburg. Joining me today from MUSC Health Orangeburg is Chris Wilson. Chris is the Director of Rehab Services at the hospital. Welcome to the show today, Chris.
Yeah, it's great to be here. Thank you for having me.
Of course. Now tell us who you are, your background, and what it is that you do as the Director of Rehab Services.
Yeah, absolutely. So I'm the Director of Rehab Services, and so that covers a lot of different things. So we have our inpatient rehab here, we have our acute care rehab here, but most importantly right now, and what I want to focus on is we have our HealthPlex, which is our fitness center, and we have 5 fitness centers. We also have outpatient rehab, which is physical therapy, occupational therapy, and speech-language pathology to help people. And we also have our sports medicine program that we're really excited about as well. And so that's kind of my area of expertise and my focus area here at MUSC Health Orangeburg. My background is, I like to say I'm a geographic mutt. I'm a military brat. So my dad was military, I grew up military, I went into the military. I got the GI Bill and I said, what do I want to do when I grow up? I still haven't really figured that out, but for right now, I've got my doctorate in physical therapy. I'm the Director of Rehab, and I'm happy to be serving the community of Orangeburg and Calhoun counties.
Now, how long have you been here at MUSC Health Orangeburg?
It has been a little over 4 years. I arrived in December of 2019.
Oh, you arrived in December of 2019. Yeah. So now you talked about a variety of different things that you do, but you did mention that the hospital has, did you say 5 centers?
Yes, absolutely. So we have 5 fitness locations.
Okay.
So we have our flagship is in Orangeburg. It's here at the hospital. It's called HealthPlex. And so that's our primary one. It's our biggest one. It's got the most variety of equipment. And all the equipment is new as of October 2021. When we updated all the equipment in October 2021, one of the things we felt was really important is sometimes the satellite locations were almost, I don't want to say forgotten about, but they had fallen behind a little bit.
Now, are those in the rural communities?
Yes, so we have one in Branchville,
okay,
one in St. Matthews, one in Santee, and one in Holly Hill.
All right, okay.
And all of them are 24/7 access for our members. They are largely unstaffed most days, but we keep up with them to keep them running and everything working and responding. But our staff works out of Orangeburg, goes out and services the different locations, and we sign people up here in our Orangeburg location.
Now, how can people access the fitness center, and are they, is there a charge for people to attend?
Yeah, absolutely. So there is a charge for people to attend the HealthPlex Fitness Center. It's open to the community. The cost is $25 a month for an individual, or $40 a month for a family that covers up to 3 people. There is an annual fee of $40 a year for an individual, or $60 a year for the family, and we can do that either lump sum or we can spread it out over the course of those months. And we do have a promotion going on right now in the month of January, New You, New Us. So if you're looking to start your fitness journey, you can join at a discounted rate right now. It is $15 a month for an individual, or $30 a month for a family of up to 3 people. And that gives you access to all 5 facilities. They're all open 24/7. If you're 16 or older, you're able to work out independently. If you're younger than that, you just need to have a parent with you or a guardian of some kind. And we want to remove barriers to healthy lifestyles.
I love that. And so we're going to take a break, but when we come back, we're going to talk about how do we get motivated. I got to include myself in that. How do we get motivated to stay active? New year, new you, because everybody wants to lose weight and be their best self for the new year. But when we come back off break, I want you to tell us how we can motivate ourselves. We'll be right back. Welcome back to the Health and Wellness Hour. We're still here chatting with Chris Wilson, the Director of Rehabilitation Services at MUSC Health Orangeburg. Now, Chris, before we went to break, we started talking about, motivating ourselves to be our better selves with staying active and being motivated to work out and exercise. What advice would you give to those of us who have already fallen off the wagon?
Yes, so that's always a very common question in terms of how do I get motivated, how do I stay motivated. And so there's a quote, and I'm going to butcher it, I'm sure, but basically it says, in essence, you want to focus on discipline and not motivation, because discipline will sustain you.
A lifestyle.
Motivation wanes. That's right, because motivation is going to come and go. You're going to be motivated some days. You're going to be not motivated some days. That's human nature. But you want to create patterns. You want to create habits. You want to stack those habits. Hey, I get up, I make my coffee, and then I get my shoes on to go to the gym, right? So it becomes part of your daily, hey, I'm not feeling 100%. I'm still going to go to the gym. It's just going to be a lighter day. But in terms of how do we get to that point, so motivation, we leverage that to jumpstart it.
Okay.
And then we've got to figure out how do we sustain. And I like to tell people a couple of things that usually help out and sustain. So one is if you have a goal you're working towards, right? Something that is achievable, right? That you can actually do, right? If you've never run a marathon before and you've never run really before, probably running a marathon is not your ideal goal to achieve, but a 5K can be good. So you want to figure out something that makes sense. And then the other thing that really helps a lot of people is a buddy. Oh, yeah. Somebody that will go with you, somebody that when you're not 100%, there's like, you know what, it's okay, but let's still go.
They need to be a little more motivated than you are, right?
Yeah, or it ebbs and flows, and they got good days, you got good days, and together you have more of those good days together. But having that other person, really, because sometimes whether you need a spotter, if you're lifting free weights, whether you just need somebody else to be there and talk to you and make it more fun, but that buddy can be really, really important. And then the other thing that happens a lot of times is people ask me, okay, well, what do I have to do? I hate running, Chris. Don't tell me I got to go to the gym and run. And I tell everybody I can, the best exercise, the single best exercise you can do is the one you're going to do.
Oh, I like that.
There's not a good, there's not a bad, but it's about what resonates, what makes sense to you as an individual. Try some different things out. Lifting weights can be great. Circuit training can be great. Treadmills, ellipticals, steppers, all sorts of things. So many options. It's hard not to find something that makes sense for you.
And we know that staying active and exercising helps alleviate a lot of health conditions, but can it also prevent certain health conditions and reduce your risk of developing chronic illnesses?
Yeah, I'm glad you said reduce risk, because I'd like to really focus on that, because prevention is technically so hard, and it's kind of this buzzword, but what does it really mean? But yeah, absolutely, because prevention also, we can't change genetics. And so some people are more predisposed to different things, but fitness, exercise can help reduce risk, can help say, hey, yes, I know I'm predisposed towards hypertension or diabetes, but exercise can help reduce or delay how that onset is or the impact of it when it happens. So yeah, it can definitely it can impact your bone health, your physical health, your brain health. Exercise helps with even recovery from things like cancer and medicine uptake. There's almost nothing.
Tell me medicine uptake, what's that?
Patients who have a diagnosis of cancer get prescribed medicine, and there's research now coming out to say if you exercise vigorously, then now all of a sudden the medicine is absorbed better and has a bigger effect on the body and its ability to treat the cancer within the body. I mean, it's fascinating to see the stuff that's coming out on exercise as medicine.
And that's something that you can do really at no cost if you choose to in your community, but the fact that MUSC Health Orangeburg has 5 fitness centers that people can access, and in our rural communities in your catchment area, to me is great information I don't think our community knew before today. So thank you for mentioning that. We're going to go to break. When we come back, Chris, I want to talk about some other therapies such as physical therapy, occupational therapy, speech therapy, and the things that you guys kind of focus on in your purview. We'll be right back. It's People Station. Thank you guys for sticking out with us for the Health and Wellness Hour. We're still here chatting with Chris Wilson, the Director of Rehab Services at MUSC Health Orangeburg. Now, Chris, before we went to break, we were starting to talk about other therapies. We have the Healthplex, you have sports medicine, you have the fitness center, but what other therapies are available and what other supports are available?
Yeah, absolutely. So people get aches, pains, and strains. They get injured, whether it's sports medicine or athletes in the high schools, or it's our weekend warriors, or just people out there day-to-day, slips, falls.
Now, what is a weekend warrior? I don't know if I fall into that category.
Weekend warrior, those are the folks that, Monday through Friday, life is busy, it's hard, but, come the weekend, it's time to hit the gym or go do basketball or those kinds of things. And so we go from zero, it's from 0 to 60 in no time at all, right? It's like I'm not doing anything, and the weekend hits, and boom, I go full tilt, and that's where we're sometimes at risk for injuries and that kind of stuff. So we have therapy can help bridge that gap, right? If you're an athlete that gets injured, you may get sent to physical therapy. if you're somebody that's out in the community, you may have an injury, and one of the best things that you can do is start with physical therapy, occupational therapy in particular. Those two disciplines are really helpful. And what a lot of people don't know is that you can see a physical therapist or occupational therapist in the state of South Carolina without a referral.
Oh, that's good. So they don't have to go to their primary care doctor and get a referral before coming to see you guys.
Yeah, that's often the case true. There are times where insurance companies will sometimes require that, and so we try to help identify that for people, and we'll let them know, hey, we do need a referral. And we love referrals too, right? We want to be collaborative with the physicians, the nurse practitioners, the physician assistants, the orthopedic surgeons, neurologists. We collaborate with so many different health professionals for so many different conditions. But for many people, something happens. The best medicine sometimes is not surgery, is not pharmacology. It's actually starting with, hey, motion is lotion.
I love that, because I'll tell you, as a gerontologist, that's one of my go-tos in terms of developing a care plan. I always bring in and recommend therapy, whether it's PT or OT or speech, because it gives a person engagement, it gives them range of motion. And I've actually seen where some of my individuals, it looks like they come to life, they become more engaged, they become more active, so it is medicinal.
Yes, and so our physical therapists, they're going to focus on things like walking, maybe ACL injuries that have happened to folks, balance, fall risk is a common thing we see folks on, patients who've had strokes. And our occupational therapists, they're going to focus a little bit more on hand injuries, maybe shoulders, also strokes. And our speech language pathologists, again, strokes is a common theme. Unfortunately, it does happen. And then they also focus on other kinds of things related to speech and how we communicate, articulate, those kinds of things as well. And a lot of those services, they're undervalued, underutilized, but can really have a tremendous impact.
Now, Chris, how can folks get in contact with you, your team, or become a part of the Healthplex or the fitness center?
Yeah, so if they want to join the Healthplex, if they want to start their fitness journey, they can reach out to us at ocfit@musc.edu. They can call 803-395-2752 and speak to one of our team members. We'll be glad to help. Wonderful. If they want to start therapy, they want to call our therapy team, and that's going to be 803-395-2804, and press the number 1 to talk to a person, and we'll be able to kind of answer any questions, get you situated, verify if you need a referral, and go from there.
I love it. Thank you so much for being here, Chris.
Yes, thank you for having me.
And thank you all so much for tuning in to the Health and Wellness Hour, sponsored by MUSC Health Orangeburg. Until next time.